Osteopathic treatment isn't limited to muscle and bone. In this Picmonic, we will learn about lymphatic treatments aimed to decrease systemic congestion through this wacky drainage system. Osteopathic treatments for the lymphatic system can be direct, to directly remove impediments to flow, or indirect, by targeting surrounding tissues. The lymphatic treatments are diverse and fall under a wide umbrella, or a wide cloud shown as lymph limes raining down on our bathroom-themed landscape. The first step in treating the diaphragms is to perform thoracic inlet release. This is done by performing myofascial release on Simpson's fascia, which frames the thoracic inlet. This is shown in our Picmonic as these lymph limes precipitate onto the lymph lime drain. The next step is to dome the diaphragm, seen as the dome diaphragm trampoline. The clinician facilitates expiration and resists inspiration to assist lymphatic drainage. The diaphragm dome trampoline bounces limes to the pelvic diaphragm trampoline. This illustrates that the next step is to release the pelvic diaphragm in order to release lymphatic return to the thoracic duct. Clinicians can also treat the lymphatic drainage in the head, eyes, ears, nose, and throat. Auricular drainage technique occurs when the clinician places the patient's ear between their fingers and applies circular motion. Here, we can see the ear aura drain as the lime juice swirls clockwise and counterclockwise. Effleurage is depicted as flowing flowers and is a sinus treatment where gentle pressure is applied to return lymphatic drainage to the body cavity. Anterior cervical mobilization can be seen as this character in the background, the anteater cervix cat. This technique is commonly used in upper respiratory tract infections and consists of mobilizing the anterior cervical cartilaginous rings. The last HEENT technique in our panel of characters is the gall breath technique, visualized as this gal struggles for breath against the parading hurricane of lime juice winds. This technique consists of sweeping pressure across the mandible with the aim of relieving lymphatic sinus congestion. Our last category has the techniques that mechanically mobilizes the lymphatics. Cranial field osteopathy can be envisioned as the ostrich path. Diagnosing the various strain patterns and treating the CSF and reciprocal tension membrane may facilitate fluid drainage to the rest of the body. Muscle energy to the thoracic inlet can also assist thoracic drainage. It is easy to draw a parallel between Muscle Man twisting his neck to combine with the energy of Thor's axe and using muscle energy to release the thoracic inlet. This technique is complementary to the thoracic inlet release. The thoracic pump increases the thoracic range of motion, therefore lymphatic return, just as our cartoon thorax pump ungulates around to get lime juice moving. The splenic pump is a technique seen as the spleen with spoon pump, where the clinician applies gentle force to the spleen to assist with immune cell circulation. Next, we see the liver pump compressing lime juice at its maximum capacity. The liver pump occurs when the physician compresses the liver in conjunction with the respiratory cycle to assist in vascular congestion. Our last pump is the pedal pump, illustrated in our Picmonic as the foot pedal pump draining lime juice to the earth. In this motion, the patient's feet are locked in dorsiflexion and rhythmic force is applied to the patient to promote lymphatic return. The last technique is known as rib raising, shown by these ribs raised from the ground and spreading apart from the lime juice pouring out of the earth. This works indirectly on the lymph system by normalizing sympathetic output. So, to summarize, lymphatic treatments fall into three categories: diaphragm release, HEENT, and mechanical techniques. First, it is important to release the thoracic inlet with myofascial release. Then, dome the diaphragm with the aid of the respiratory cycle and release the pelvic diaphragm to promote lymphatic drainage from the lower extremities. Effleurage is a technique that uses gentle downward pressure on the anterior sinuses in congested states. Anterior cervical mobilization involves manipulating the anterior cartilage rings. The last HEENT technique is the Galbraith technique, which involves mandible traction and is contraindicated in patients with temporomandibular joint dysfunction. Cranial field osteopathy is most commonly indicated to increase venous drainage from the head. To complement thoracic inlet release, muscle energy can be used on the thoracic inlet to further complement lymphatic drainage. The thoracic pump, splenic pump, liver pump, and pedal pump involve rhythmic motions to facilitate lymphatic return. Rib raising is the last osteopathic technique in which sympathetic output is regulated to indirectly promote lymphatic return.
Good heavens! It's not raining cats and dogs out here. It's raining lymph limes. All that lime juice has to go somewhere, And thankfully, there's a lymph lime drain to funnel it all away. It pours over the dome of the diaphragm trampoline and down onto the pelvic diaphragm trampoline. All the pressure of lime juice builds up on these trampolines until they release and bounce it on its way. It flows into the ear aura drain, swirling as it goes down, clockwise and counterclockwise. Flowing flowers get kicked up by the lime juice waves. But not everything is so pretty. An anteater with a cervix cat gets caught in the flow and washed downstream. They stay afloat by swishing their tails side to side. A gal struggles for breath against the pressure of the lime juice sweeping her along. The liquid culminates in a cranial field, flowing down the ostrich path. A muscle man twists his neck and combines his energy with Thor's axe to quell this citrusy storm.
For the rest of the story, check out Picmonic.com and sign up for a free account. There, you can also take Picmonic's quiz. The quiz automatically sets up your daily quiz by using spaced repetition algorithms based on the questions you've missed or struggled with to make sure you study what you need when you need to.
And while you're there, check out the rest of our treatment modalities Picmonics. We've got all the content you'll need to remember. Everything from muscle energy, counterstrain overview, high velocity, low amplitude thrust, or HVLA, myofascial release and soft tissue, Zinc's common compensatory pattern, and so much more, so you can lock down on everything you need to know forever.
Play, quiz, and spaced repetition. Efficient, effective, and research proven to increase exam scores.